Yes, now Jyot says good. What about others? Like, how are you? Are you practicing? Are you regular and doing questions? Yes, Lakshmi, Jibins, Humphrey, Dhanya. So how are you all doing? How are you practicing? In the sense, are you on the right path? Is there an improvement?
Yes,
Are you finding good? Yes. Okay. So nice to know. Doing good. Fine. Okay. Still finding hard with SATA. Uh, okay, SATA question still finding hard. So keep practicing. Okay, so you will be, I mean, so one fine day, anyway, SATA is not going to be very easy because you need to practice a lot. Okay, keep doing SATA questions. Hope you are aware that SATA questions, we have separately uploaded SATA questions too. Okay, so try solving only SATAs. Fine, so try solving only SATAs and you will definitely find improvement. Okay, yeah, so yes, okay, fine. So let me begin with today's session, and today we will be continuing with what was discussed on Monday. Okay, so Marjorie had discussed a few aspects on ethics and legal practices, and we would be mainly focusing on the questions. And apart from that, I would like to reflect some other topics that are related to ethics and legal aspects. Okay, so along with leadership management. Fine. Okay, so the first topic that we are going to discuss today is something on advocacy. So advocacy, what do you understand by advocacy? Yes, nurse advocate means what? What's your role there? Any idea? So who should be your top priority while acting as an advocate? See, nurse has got numerous roles, isn't it? So she is a teacher, nurse is a researcher, nurse is a change agent, okay, whatnot. So numerous roles are there for a nurse. But what role specifically when we say nurse advocate, what do you understand by this? Advocacy means what? You talk for your patient, okay, you assess your patient, your client, okay, you try to promote bring comfort in your client, you try to promote equality, okay, so you try to provide freedom from suffering, okay, so these are all some of the role as an advocate. Fine, so let us just look at the definition. So advocacy in the sense or the aspects of the same. So nurse act as an advocate mainly to her client as well as significant others. Okay, so what is your main role here? Your role is to protect patient's rights. Okay, the patient's rights need to be protected. So do you have some idea about the patient's rights? What are all the client's rights? Yes, can you name a few clients' rights? Please, one or two. Please answer.
Right to refuse, right
Right to
to
refuse
treatment.
treatment. Okay. So then what else?
autonomy.
Autonomy. Yes. Right to have freedom. Okay. What else? What else?
Justice.
They are the principles. If we are talking about autonomy, justice, maleficence, beneficence, and all, you know, so they are the principles. They are the important code under the ethics. Okay, so that you need to know. Like apart from that, I'm talking about the rights of a patient. What are those? Yes, let us discuss a few rights. Okay, so right to,
Right.
yeah, yes, Jibins.
Treatment, right, not the treatment.
Right to get right treatment. Yes. Okay, so let us,
Right to consent.
Correct drug, correct time.
yes, all these can be considered as rights, but still let us formally look at some of the rights. Okay, so mention here right to have a considerate and a respectful care. Okay, so these are our self-explanatory points. I don't want to explain again and again on these points. So anywhere, if you don't understand, please ask me. Okay, what does that mean? So you are free to ask. Well, let me just show some of the rights, client rights, okay, which you need to know. Because being a nurse, when we talk about advocacy, it is your role to provide or to preserve the client's rights. Okay, yeah. So client right to considerate and respectful care, right to be informed about diagnosis, possible treatments, and likely outcome. Okay, and to discuss this information with the healthcare provider. Hope you are following. Right to know the names and roles of the persons who are involved in the care. Okay, so you are supposed to reveal the names who all are providing care to your client. Right to consent or refuse a treatment. Okay, so this is just like informed consent. You have got informed refusal card also. Okay, so like for example, if the client wants to be applied with compression devices, okay, so pneumatic compression devices, so he could be in order to prevent from DVT and all, so he refuses that. He doesn't want that. Okay, pneumatic compression devices. So in that case, so he has to, there is something called as informed refusal, which means that you informed about its consequences of about the consequences of not using this particular machine, and still the client refused, and the client has to sign that. Okay, so that is informed refusal also, just like informed consent. However, the client has got the right to consent and even refuse a treatment. Okay, right to have an advance directive. Hope that was discussed in the last class. What is advance directive? What are the two kinds of advance directive? What are the two kinds? Yes?
Healthcare proxy and living will.
Very good. Healthcare proxy and living will. Okay, fine. So right to privacy, right to expect that medical records are confidential. So this is very important. Okay, so the client should the client can expect that his medical records are confidential. You are not supposed to reveal his information to anybody else who is apart from those who are involved in the direct care of the client. Okay, so if the client says that even his parents are not supposed to be revealed about what's there in his record, you need to follow it. Okay, the record should be confidential. So, and the client, that is one of the client's rights. Okay, yeah. So we'll move to the next one. Right to review the medical record and to have information explained. However, see, remember, if the client says, okay, my information can be, okay, about me, my condition can be explained to so and so, if the client says that, so then that can be revealed. Okay, so otherwise it should not be revealed apart from, like, I mean, so those who are involved in the direct care, so they can be revealed, or for them the information can be like known. So whereas apart from those, nobody else has to be revealed about the client's information. Okay, so that's very important. Yeah, right to expect that the hospital will provide necessary health services. Right to know if the hospital has relationships with outside parties that may influence treatment or care. Okay, so like for example, if your hospital doesn't provide specialized treatment, and it is the client right to know if your hospital has got any tie-up with outside parties that will influence his care. Okay, so that is his right. Right to consent or refuse to take part in research. This is also very important. Right to be told of realistic care alternatives when hospital care is no longer appropriate. Okay. Right to know about hospital rules that affect treatment and about charges and payment methods. You understand? So these are some of the important rights, the client rights that you should know. Fine. So now In advocacy, what are you learning in advocacy? Advocacy means like you are supposed to preserve, or you are supposed to preserve these clients' right. Okay, how? You need to consistently communicate. Okay, so communicate all the everything to the client, collaborate with the client and other healthcare professionals to promote, uphold and protect the client's rights, their interests and their choices, even when the nurse or other health members of the team may not agree with these choices. Okay, the client has a particular decision which you may not agree, but still you have to voice for your client. Okay, so you need to stand with your client. So that is what this role of advocacy means. Okay, so let us clearly look at some of the specific roles in advocacy, so that when you get questions on these, it will be easier for you to answer. The first role of a nurse advocate is to assess patient care needs during hospitalization and discharge. Okay, you should continuously talk to your client, communicate with your client, assess his needs. Fine. So during hospitalization and even at the time of discharge. Okay, so it is your role to provide the discharge education. Okay, yeah. So coming to the next point, reaching out to community resources as needed. For example, your client could be a chronic alcoholic or a smoker. He is in need of some rehabilitation programs or de-addiction. He needs to attend some de-addiction centers and all, which he is not aware of. It is your responsibility to identify the easily accessible community resources to him. Okay, so that is the next point. Educating patients about diagnosis and referring to specialities. Advocating for, I want to make this point very clear. Educating patients about diagnosis in the sense, you are not, please note this point, you cannot educate him or you cannot reveal to him what is his condition. That is not your role. So that is the role of a doctor, okay, or the healthcare provider. So whereas after the doctor informs about his condition, the medications, the treatment, the side effects of medications, everything should be explained by a doctor only. Okay, so whereas after informing about the diagnosis and all, if further education regarding the same condition is required, so then you can take over that. Okay, the initial revealing, explain or so informing about the diagnosis and all is the duty of the concerned doctor or the physician. Okay, yeah. So moving to the next one, advocating for treatments, procedures or tests that are appropriate for patient care or diagnosis. Okay, so sometimes what happens, so some physicians or they might recommend a procedure or a test that is actually not needed for that particular condition or diagnosis. Okay, in that case you should raise your opinion there. Okay, so you should talk for your clients and you need to make sure that only the needed treatment, procedure and tests are implemented for your client. Okay, so that is another role. Reviewing patient care concerns or grievances, providing education on insurance benefits, educating patients on current standards of practice in healthcare, whatever is followed in healthcare, okay, the standards of practice, demonstrating compassion and empathy with patients and families with regard to their healthcare wishes. Okay, so it could be in regard to the choices, the living will, what they make. Okay, so they might opt for DNR. So you should be actually standing with your client. Okay, so demonstrating compassion and empathy with patients and families with regards to their healthcare wishes. Educating patients on necessary healthcare decisions without bias or coercion. So this is another important point I want you to focus here, okay? Which means that, so the client has got, in the principle of ethics, you have learned about autonomy. Autonomy in the sense freedom to make his own decision. Okay, so this should always be in your mind. So whoever the patient is, you are not supposed, as far as he has mentally competent, okay, so as far as he is mentally competent, you are not supposed to make decisions for your client. You can educate to him, like you can educate that this is good, these are the merits, these are the demerits, you can educate, but decision making should be ultimately done by your clients only. Okay, you are not supposed, or you are not allowed to make any decisions for your clients. Please note this point. Okay, so you should not force your client to go in or make any particular decision too. Okay, so that's also very important. Don't force your client, and you can educate him about the merits, the advantages, disadvantages and all, but don't force him to take up any or whatever the decision that you wish for. Okay, so decision taking should only be done by him. But if he is mentally incompetent, okay, so if he is mentally incompetent, then the decision can be taken by the next of kin or even the court. Okay, likewise, and even there is something called as best interest of the client. Okay, based on what is best for the client, you know, so even the medical decision is taken there. Okay, so that is only if the client is incompetent, mentally incompetent, or if he is sedated, okay, or if he is under the influence of drugs and all, then he will not be able to make any decisions. Okay, so in that case, if his next of kin or nobody is available, and you know that now it's very important to make a decision, then under the best interest, a medical decision will be taken. Okay, so I mean, so based on what is best for the client, a medical decision will be taken. Is that clear? Okay, yeah. So these are some of the important roles of a nurse as an advocate. Okay, yeah. So now here there is a question based on this. I want all of you to try and give the right answer. A nurse is serving as a preceptor to a newly licensed nurse and is explaining the role of the nurse as advocate. Okay, so she is for a newly licensed nurse. So you are educating about the role of a nurse as an advocate. Which of the following situations illustrates the advocacy role? Which of the following situations illustrates the advocacy role? Verifying that a client understands what is done during a cardiac catheterization. Discussing treatment options for a terminal diagnosis. Informing members of the healthcare team that a client has DNR status. Reporting that a health team member on the previous shift did not provide care as prescribed. Assisting a client to make a decision about his care based on the nurse's recommendations. What do you think so? Like, can I get some answers in the chat box? So what all did you learn under the role of a nurse, under the role of a doctor, under the role of a patient? Yes, can option A be selected? Can I get some more answers? Try. Think in the last class, what did you learn? Okay, I'm getting some responses. Whereas I think that you need to be a little more clear in understanding some of the aspects. Verifying that a client understands what is done during a cardiac catheterization, which means what? You learned about informed consent, isn't it? So who has to explain about the procedure? Who has to explain about the procedure?
Doctor.
Healthcare
Doctor.
provider.
Yes, only doctor can explain the procedure. Whereas if certain procedures that are within the scope of a nurse, like for example, urinary catheterization, this usually nurse does, isn't it? So, and even the tube feeding, tube insertion, NG tube insertion and all, a nurse does. So those procedures and all, only a nurse can explain. No need to call a doctor there. Whereas if any procedures are done by a doctor, so then those procedures should be explained by the doctor only, not a nurse. While explaining, the nurse, before obtaining the informed consent, the doctor has to explain, okay, and before getting the sign, then what the nurse should do, the nurse should verify whether the client has understood whatever the doctor has explained. Okay, so therefore option A is one of the right answers here. That comes under the role of a nurse. Okay, discussing treatment options for a terminal diagnosis. Who can do this? Can a nurse do this?
No.
No, only a doctor. Okay, you cannot select that. So informing members of the healthcare team that a client has DNR status. Can she inform or not? Think as yes or no. Yes, of course, you can
Yes.
select that. Yes, she can inform, isn't it? Reporting that a health team member on the previous shift did not provide care as prescribed. Is she supposed to report? Yes, she has to report. Yes, because so something, if she acts as an advocate in the sense what? She should be protecting her client from any harm. Okay, so like for example, if your client is somebody is approaching your client without following the infection control precautions, okay, then you have to definitely report, because your client is gonna be under harm. Okay, so therefore that has to be reported. If something was not provided as per the protocol to your client, so that should be reported. Okay, so therefore option D is also right. Okay, assisting a client to make a decision about his care based on the nurse's recommendations.
No.
Assisting a client, no. Okay, you cannot help a client to make decision. You can educate about the needed aspects, like the merits, the demerits of a particular procedure or a treatment. Okay, whereas you cannot assist a client in making any decisions. Okay, so therefore, so which are the right answers? So options A, C and D are the only right answers. Is that clear? Okay, so we will do some more questions later, but before that, let me finish some important topics that we have to discuss in today's session. I believe the role of advocacy was clear to you. Is there any doubt under the role of advocacy? Yes? Any doubts?
No, ma'am.
No? Okay, so shall I move to the next topic? Yeah, so next I would like to talk about some of the ethical dilemmas. Okay, so ethical dilemma. What do you understand by ethical dilemma? Dilemma means what? Dilemma means what?
Kind of
Confusion between
confusion.
right and wrong.
Yes, exactly.
Confusion.
Exactly, not knowing what is right or wrong. Okay, there are two aspects. So where the nurse actually finds really difficult to select what is right or what needs to be done. Okay, so that is what we can call it as dilemma. Ethical dilemma are the situations in which a choice must be made between two options. Neither option is perceived as an ethically responsible solution. Okay, so this is something we can call it as ethical dilemma. Can I get some examples from your side? Any one or two example for ethical dilemma, which usually a nurse face? Yes.
Euthanasia.
Euthanasia. Yeah. Okay. So that is one such dilemma. Fine. So then what else? Dilemma in regard to science. Yeah, so as you said, euthanasia. Okay, so euthanasia is something that is based on the science. Okay, so I mean, and this euthanasia and spirituality can actually conflict the nurses. Okay, so because the religious or spiritual, those who are highly religious and those who are having a strong spiritual conviction, so what they will be focusing on, where the humans are not supposed to, I mean, so to take life on their own. So that is what the spiritual or the religious aspects teaches, isn't it? So that is science versus spirituality is one of the ethical dilemmas that usually happen. Okay, so then what? Any other
Palliative
example?
care.
Sorry,
Palliative care.
palliative care. Okay, can you be more specific under palliative care? What sort of dilemma? Whether to what you actually were focusing on under palliative care?
Someone is not having quality of life, but she's having infection, and but they are on palliative care. Even though we could support under palliative care, we are not able to support.
Okay. Sometimes what happens is, there are some medications so which could be beneficial for the client. Okay, so whereas if we look at the principle of autonomy, so patient's autonomy can go against the medical directives. Okay, so that is what you wanted to say, I believe so, like, which means that autonomy versus beneficence. Nurse know that, so these all medications are good for the client, but at the same time the client can refuse them. Okay, so there arises ethical dilemma. So we are confused what to do there. Okay, so whether to go just to select this or to select that. Okay, so that's what we can call it as ethical dilemma. So now how can you solve this ethical dilemma? How can you solve? See, there are certain steps that are involved in that will help you to solve the ethical dilemma. Okay, the first one is problem definition. Problem definition in the sense, understand the problem as a whole. Okay, so what is the actual problem? Or like what is the dilemma actually? So understanding that is very, very, very important. Okay, so that is the first thing that you need to do, identifying the problem. Okay, so understanding the problem. So that is first thing. You have to make a good understanding, or you need to have the correct problem in your mind. Okay, so the picture in your mind. So then based on that, you have to collect the facts that are relevant to the problem. Okay, so in the sense, you need to be sure that all the facts of the dilemma are there. Okay, so in the sense, like what factors, it could be family matters, or it could be hospitalization matters, or it could be the health status of an individual. You need to collect all the data so that are relevant to the dilemma. Okay, so and also you should be able to identify the relationship between the client's perspective and also what the code of ethics say, what the principles say. Okay, so you should be able to make a relationship between these. Okay, so that is what the data collection says. And data analysis in the sense, what do you understand by data analysis? Analysis in the sense, consider your client's decision. Okay, so whether it is right, or is the client free of any external influences? Is the client, based on some external influences, is the client taking up these decisions? Okay, so that is very much needed here. Okay, analyzing the problem, validating the problem. Okay, so that is very much needed here. Fine. Okay, so then selecting the best possible solution. When it comes to the best possible solution, you need to make sure that the client is what the client is actually when you don't know how to select or how to deal with it, you need to look at what the code says, what the principle says. Okay, most of the time the code of ethics or the principles in nursing that will help you to determine, or that will help you to decide what can be or what can be implemented or what can be done in that particular situation. Okay, and after that it has to be implemented, and then you will have to evaluate it. So these are the basic steps in an ethical dilemma. Okay, so like how to resolve an ethical dilemma. So let us go in detail. For example, first you need to define the problem. Okay, understand the problem. It could be you need to go through the policies, procedures, guidelines of an organization. Okay, so based on what does the organization say about this particular aspect or whatever the situation the client is undergoing, so based on that, are there any policies or are there any guidelines? You need to read that, you need to understand that. Okay, so just check the laws and values and principles of an organization. Okay, so these are the first aspects that you need to focus. And the second one is you need to, like, the second step basically focuses on data collection and data analysis. Okay, you need to identify the problem, and after that you need to get a suitable assistance, guidance and support. Okay, and you need to think or sort out what all alternatives can be set in there. So that is the next thing that you will have to do. Okay, so after keeping every alternatives in mind, so read or get back to the code of ethics, get back to the principles, and make a strong decision or make a right decision. This decision making may not be done only by you. There could be, still if you are confused, your nurse manager will be helping you out, your supervisor will be helping, or at the end, if you are not able to decide at this particular situation, the higher authorities also can be brought into the scenario. Okay, so that is what, these are the steps, or this is how you need to like when there is a dilemma, so you need to think. Basically, mainly what you need to consider is you need to check the code of ethics. Okay, and based on that you will have to arrive at a particular solution. Okay, so for example, some of the examples of ethical dilemma, and let me check how you are going to deal with this. So Clara is a 28-year-old college going student. Okay, so she's 18 weeks pregnant. She has a history of cardiac disease that has worsened because of her pregnancy. Clara's doctor is concerned that continuing the pregnancy can cause her heart condition to worsen and could result in a life-threatening emergency. He has recommended termination of the pregnancy within next 2 weeks. So this is what the doctor has recommended. Clara is reluctant, stating that she was raised to believe abortion is wrong and believes God will heal her. She wants to know what the nurse would do in her position. She is depending on you now. Okay, so if you were in her position, so what would you be doing? Nurse Jennifer does not believe in abortion under any circumstances. You are Nurse Jennifer and you do not believe in abortion. Okay, so in any circumstance. Now this is the dilemma that you are having. So may I know how are you going to deal with this? You can give, so anyone can answer, or you can give your opinion. Because patients, what they do basically, they look for nurses' advice, isn't it? Okay, so and now here there is a medical need also for treatment. Okay, and there is something that contradicts the medical need is contradicting the client's belief. Okay, so now she is depending on you. Now, what are you going to do? How are you going to deal with this dilemma? And you do not believe in abortion. So my question is, can you put in your personal beliefs into the scenario?
I guess no.
No, you're not supposed to put in your personal opinions into this. Okay, very good. That is one good answer. Yes. Next, how are you going to deal this? So what, go to the step. You identified the problem now. The problem is identified. Okay, what was the next step? What was the next step?
We will try to clear the actual problem to Clara in a very general words so that she understand that her, like if she continue the pregnancy, then that could like cause her serious like health deterioration.
But she believes that God will heal her. She's of strong faith. She doesn't, her religion believes that her religion doesn't allow her to go in for abortion. She is a strong believer. Even though you teach her, so this can actually, she may not, her mind might not change.
We can give her some examples. I don't know. Just an idea.
Go, yeah. See, what was I saying? Like previously, go to the steps. You have identified the problem now. Data collection and data analysis is there. So what are you going to do here under these steps?
That she can be like, her health can be very terminal if she continue, explain that to her, and explain what doctor have said and how it can turn out later. She might not have kids as well as lose her life. Explain that to her.
Okay, so somewhere you are coming to the point. So here, so if you need to go with the steps, okay, you need what can you do here? Although you are the nurse who do not believe in abortion, okay, but you are not supposed to express your personal beliefs there. Okay, so to the patient, you are not supposed to, the patient will be relying on you. So she is looking for your, so she's asking you, if you were in my situation, what would you do? Okay, so now here in this dilemma, in situations like this, so what are you supposed to do? So you are not supposed to express your belief or your opinion. Okay, so instead, so you should encourage the client. Okay, so you should encourage the client to talk with others, in the sense you can get opinions from significant others. Okay, so that is collecting the resources. Okay, so like wherein you can get opinions from their family, even from the spiritual advisor. Okay, and also from people whom she usually depends on advice, on seeking advice, or whom are on so in people whom she usually confides. Okay, so try to collect their opinions also. So that is what data collection means. Okay, so then you will have to analyze. So, and under analyzing, so you can consider each person's opinion. Okay, so even the spiritual advisor's opinion can be taken into this perspective. Okay, and then what the nurse should do, the nurse can schedule some follow-up visits with the physician to discuss what all the options are there. Okay, and then decide further. Okay, so then based on what the further the doctor says, so based on that, the decision can be taken here, because here there is a 2-week deadline, isn't it? So the doctor has recommended termination of the pregnancy, so within the next 2 weeks. Fine, so within the next 2 weeks, so you can actually schedule regular follow-up visits with the physician. Okay, and you can she can wait for getting, based on the continuous assessment in the next 2 weeks, some improvement might happen or may not happen, and based on the follow-up visits, some alternative plan can be identified. Okay, and then that can be implemented. So we don't know, that is just a possibility. Okay, but being a nurse, how you are planning or how you are going to solve the ethical dilemma. So that is very important here. So what you are supposed to do, you need to know the problem first. You can collect the opinions from others. Okay, so then you can schedule in the 2 weeks time, you can schedule constant visits with the physician. Okay, and wait for his opinion further in the 2 week before the 2 week deadline comes. Okay, so that is and then I mean, so decide what can be, and then since still if the doctor is into this and if the patient refuses further, so then we will have to go with the patient's decision itself. Okay, so that is what you need to know here. So that is how you will be solving this. However, ultimately, whatever the client or whatever the patient wishes, so that wishes should be taken into consideration. But during these 2 weeks time, there could be possibility where the client's mind can change based on the several inputs from different resources. Okay, so we need to wait for that to happen. If that happens, if it's well and good, meanwhile, you can schedule regular follow-up visits to the doctor and then determine, and then it is left to the Clara to determine or to decide what to be done next. Okay, still, even after regular follow-up visits and all, still the doctor says it is needed to terminate. And if the Clara is of strong faith, she says that no abortion, then so it is left to Clara's decision itself. Okay, so this is how we actually deal with the ethical dilemma. Fine. So I can also give you another scenario, so wherein you should constantly depend on the code of ethics. Okay, so for example, here there is a situation. Jaffer is a 16-year-old client who was diagnosed with a sexually transmitted infection. Although the doctor examined, sorry, it has to be Jaffer. I don't know how this Michael came. Although the doctor examined Jaffer and told him about his diagnosis privately, Jaffer's mother is in the waiting room and wants to know what the doctor said. Okay, so Jaffer told the doctor and the nurse that he does not want anyone to know about the sexually transmitted infection, including his mother. So now what are you going to do here? Yes. This is the dilemma wherein you have to protect. There are two situations. One is the mother is waiting to know what has happened, whereas in another situation, you need to protect the client's right to privacy also. How are you going to deal with this situation? Because he is an adolescent, usually still under age of 18. Like I mean, so till the age of 18, the parents are supposed to take care of him, isn't it? So he is considered as minor.
We have to talk about
apart from there are different scenarios also, like emancipated minor. Hope you would be aware about that. Emancipated minor. So now he is not coming under emancipated minor, but he's only a minor. What are you supposed to do?
We have to explain our procedure and protocol to Jaffer. That he is under age, and for this age we have to discuss the condition with the family or next of kin, or we can even ask him if there is someone else who like except from family or his mother, if there is someone who is like more close to him and he wants to share those information with him.
Okay.
And we have to explain the protocol, that policy that we have to share this information. As he's minor, we are not supposed to take any decision or anything on his. He is neither able to take any decision on his behalf. So we have to involve like someone to talk or take decision on his behalf for for any, like, treatment plan or anything in the future. Yeah.
Very good. So here, very good, Richard. So thanks for contributing. So here, what you have to consider is being a nurse first and foremost, because every state has particular laws in regard to the minors' consent and all. Okay. So now Jaffer is a 16-year-old child. So generally, we can consider him as a minor, but still, you need to go with the state's protocol. Okay. You need to check whether he comes under any of the laws that will allow his medical needs to be confidential or not. Based on the state's protocol, you need to first check that. Okay. And if it doesn't belong to any of the protocols that will declare his confidentiality, his medical aspects and all, that has to be confidential. If none of the laws say that, so then it is very much needed to make him understand that it is vital to explain to his parents, because he is a minor and treatment cannot be continued for a minor without the parents' consent. Okay. So now, but if he is a minor and if the state laws allows him to to give the consent and all, so then you need to keep in mind that whatever the information that was provided by the doctor about his condition has to remain confidential. Even the mother should not be informed about the same. Okay. So this solely, in this situation, it solely depends upon the each state laws in regard to the consent. Okay. So based on that, the decision has to be taken. Is that clear? Okay. Yeah. So these were some aspects regarding the ethical dilemmas and all. However, so please remember the initial, so the steps that are involved in solving the ethical dilemma. Okay, so identifying the problem, collecting the data, analyzing it one after the other, and then selecting the best possible solution, implementing that, and evaluating the results of action. Okay, so these are the steps that are involved in resolving or resolving ethical dilemma. Fine. Okay, so now let me take question based on this. So just a minute. Okay. So what is I want everyone to try. Okay. So what is the best order of these actions in order to promote the resolution of an ethical dilemma? So you need to give the options, which has to be in the order. Steps that are involved in resolving an ethical dilemma. Yes. First, what are you doing? List the actions that could be taken to resolve the dilemma. Agree on the statement of the problem or dilemma so that you are trying to resolve. Agree on a plan to evaluate the action. Gather all relevant information regarding the clinical, social, and spiritual aspects of the dilemma. Okay, so take time to clarify values and distinguish between facts and opinions, your own and those of others involved. Okay, so negotiate a plan. So these are the steps that are given here. What was the first step? The first step was problem definition. Problem definition means what? Problem definition and agreeing a problem are different. Agreeing a problem and problem definition, both are different. Okay, the first step was problem definition. Problem definition in the sense, know the problem, that's it. Okay, what is the problem? You need to know the problem. Whereas here, that problem definition is not there in these steps. Okay, so rather, so you are confused between agree on a statement of the problem or dilemma that you are trying to resolve. Agree on a statement in the sense what? What do you understand by this? What is the difference between defining a problem and agreeing on a statement of the problem? Defining the problem in the sense, know what is the problem. Okay, so whether the problem is that the client is refusing the treatment, whereas the treatment is needed. So this is the problem. Okay, so now for this problem, so what are you going to do now? The steps you need to check here. Okay, so agreeing on a statement of the problem means you are actually, after knowing all the facts, you are actually understanding the nature of the problem. So that is agreeing on a statement of the problem. For this will not come under the first thing. Rather, the fourth option goes as the first step. Okay, gather all relevant information regarding the clinical, social, and spiritual aspects of the dilemma. So this should be taken into first aspect. Okay, so this has to be the first step. Fine. So then what are you supposed to do? So you need to take time to clarify values and distinguish between facts and opinions. This should be the second step. Okay, so first you need to collect all the necessary information, the resources, everything has to be collected. So then you will be clarifying, you will be analyzing everything. Okay, so that should come next. And after that, you are actually going to know the nature of the problem. Okay, so after identifying everything, so you are actually getting back to this focus once again. Okay, so this is the third step that you need to consider. Fine, so this is not the first step. So this is the third step that you need to consider, knowing the nature of the problem. Could be a little confusing here, but try to understand. So please understand what I'm trying to say. So that is like agreeing on a statement of the problem, and problem definition is different. Problem definition means just know the problem. Agreeing on a statement of the problem in the sense, after going through all the resources and after checking everything, you are actually knowing how serious this is, or actually what is the nature of the problem. Okay, what are you trying to resolve? So knowing that is something we can call as agreeing on a statement of the problem. Okay, so therefore, so after gathering information and clarifying values, then you will be going on agreeing the problem. Okay, after that, so you are focusing on listing the actions, so that could be taken to resolve. These are all the steps I can do here. So you will then select this. Okay, so 1, 2, 3, and this is the next thing. Okay, and last and after that, what are you going to do after that? After this, what
Negotiate a
will be
plan.
selected? The next one?
Negotiate.
Yes, negotiate a plan, and
plan.
negotiate a plan, and then last you will be evaluating it. Okay, so these are the steps. The first one is gathering all the information, then clarifying the values, facts, opinions, everything. Then you understand the problem actually, and you list down the steps that are involved here, and then you negotiate, and then you evaluate it. Okay, so these are the steps that are involved. Fine. So let us move to the another question based on this. Yes. Place the steps. What are the steps? What are the correct steps to resolve an ethical dilemma on a clinical unit? Place the steps in the correct order. Same thing, just like the previous one, only it is slightly changed. The way how the options have been put, so that is changed. That's it. First one, what? What is the first step?
Second one,
Ask the
Second
question.
one. Second one. Very good. Okay. Ask. Yes, this is the first step. Okay. Next.
Gather information.
gather information. Fourth one,
Gather information. Very good. Okay. Then
Visualize the problem.
that should come next. Clarify. Yes.
clarify values,
Okay. Clarify values. Then
Verbalize the problem.
identify the
then
course
comes
of action.
verbalize the problem. Yes. Okay. So then comes verbalize the problem. Okay. Then
Identify course of action.
Identify course of action.
identify the course of action. So 1, 2,
Negotiate
3.
a plan.
Negotiate the plan.
Yes. Negotiate a plan
And
and
evaluate.
Evaluate the plan.
Evaluate it. Okay. Hope you are. Yeah. So
Gather information.
sorry, somebody is talking. Okay, so no, I think so. There was some background disturbance. Okay, yeah. So these are some important. So the ways how you are actually focusing on this. Okay, yeah. So now that was about the two main topics that we had to discuss today: advocacy, the client rights, including the client rights, and the ethical dilemmas. And next, I would like to, though not that important, I just like to review some of the leadership styles. Okay, so that are very much needed in nursing. Okay, so the leadership styles. So let me share my screen. Okay, so now under the leadership styles, are you aware of any leadership styles?
Democratic,
Autocratic,
laissez-faire.
laissez-faire. Very good, very good. Okay, so good knowledge on different leadership styles. Yes, so these leaderships, there are different styles under leadership. So which a nurse has to enact based on the situations. Okay, so let us see the first one. The first one is servant leadership. Okay, so servant leadership. Servant leadership means what? Like they influence and motivate others by building relationships and developing the skills of the individual team members. Sometimes, very rarely, a question can be put. They might give some example and they will ask you to identify the kind of leadership there. Okay, so now here, servant leadership in the sense, they value people, they listen to people, they are highly caring. Okay, so and they create they are highly, so they want trust in their team, and they render towards this leader, they render unselfless services. Okay, so that is something we can call it as servant leadership. So these are some of the characteristics that you need to know: listening, awareness, acceptance, persuasion, commitment to the growth of others, building community within the organization. Okay, so these are some sole characteristics of servant leadership. Okay, so servant leadership, they are mainly oriented on relationships. Okay, so they make sure that their employees have the skills, tools, resources that are required to achieve goal. They are more involved in employee development. Okay, they are goal driven. They are more involved in employee development. Okay, so they are great listeners. They believe basically in trust and in growth factors. Okay, so trust is very important for them. So these are the characteristics of a servant leader in servant leadership. Okay, next comes transformational leadership. Transformational means what? They are highly motivational. Okay, so these
Ma'am,
transformational
please
leaders
show the
are
last slide, please.
this one.
Yes,
Yeah.
it's okay, ma'am.
Okay, yeah. So
Yes, ma'am.
transformational leadership means what? Transforming means they want to bring change. They want to bring change in their environment. Okay, so they are transformational leaders. Fine, they want to bring some change in their environment. Fine, so they are visionaries in the sense, so they make sure that they usually try to keep, they mentor always, they build confidence in their client. Okay, they encourage teamwork. They want nurses to act independently. They listen to ideas. Okay, so they are see, what is the difference between servant and transformational? Servant in the sense, they are not highly inspirational and all, whereas their focus is to build trust in the team, work towards the goal. Okay, commitment should be lots of commitment is needed in servant leadership. Okay, so these are the characteristics of a servant leader. Whereas in transformational people, transformational leadership in the sense, these nurse leaders are highly motivational. Okay, they bring transformation in the particular setting wherever they are working. They motivate the nurses, their employees. Okay, so they have a great mentoring skill. They build confidence. They encourage teamwork. Okay, so these are the these are the characteristics of transformational leadership. Okay, or a transformational leader. Fine. Okay, the next comes democratic leadership. Democratic in the sense, hope you are aware of that. Democratic leaders in the sense, what? Democratic leader means based on this leader encourages continuous feedback from their team members. Okay, so they want continuous feedback from their team members. They encourage personal growth, professional growth. Okay, so they want to, based on the feedback, they try to improve the quality in a particular setting. Okay, so quality assurance and is the basic key for a democratic leader. Quality assurance, they get
So,
feedback. Yeah,
ma'am, what is difference between servant and democratic leadership?
servant leadership in the sense, the leader itself is involved in doing all the activities. Okay, so he works selflessly for the team. So that is a servant leader. They are more empathetic. Okay, so they build trust in the team. So these are the specific qualities of a servant leader in the sense, they are more oriented with the relationship. They want the relationship between each employees to be very strong. Okay, and then with the strong relationship and trust, they try to build the team. So that they are the characteristics of a servant leader. Okay, whereas democratic in the sense, what? Democratic leader get feedback from their employees constantly, and based on the feedback, so they will try to build their so the setting. Okay, so that is what you need to understand by a democratic leader. Okay, so democratic leader will encourage feedback, communication from the team members. It is a collaborative style. Democratic leader works based on the basis of so he is more involved in collaborative style. Okay, so that is the difference between a democratic leader and a servant leadership. Is that clear? Okay,
Yes,
yeah.
ma'am. Thank
So
you.
next comes authoritarian leadership. Yeah, authoritarian in the sense, Hitler kind of leadership. Okay, so authoritarian leadership. So authoritarian or autocratic also we can say sometimes. Authoritarian, which means that they get no input or very little input from their employees. In democratic leadership, constantly inputs are received from their employees, isn't it? Whereas in authoritarian, like I mean the employees do not make any decisions. Okay, autocratic nurse leaders, what they do, they are very, I mean, so autocratic nurse leaders are required in emergency situations, in emergency departments and all. Okay, so if democratic leaders are working in the emergency department, what will happen? They keep giving feedback to do this, to the that and all, then ultimately the patient will die. Okay, so this should not happen in the emergency departments. In emergency departments and our autocratic leadership is very much required there. Okay, so they make decisions with very less input from their employees. They are highly in the sense they have a very good knowledge. Okay, and they are highly skilled also, autocratic leaders. Okay, so but they lack in building a team and in developing trust and all. They, in autocratic leadership style, you know, open communication and all will lack. Okay, so whereas they work well in emergency situations, so that is autocratic leadership. Fine. Okay, then comes laissez-faire leadership. So laissez-faire leadership in the sense what? Laissez-faire, they are just like laissez-faire in the sense they give everything to their employees. They are least involved in supervising and all. Okay, they love creativity, new styles and all, whereas usually laissez-faire leadership is taken by inexperienced nurse leaders. Okay, so this kind of leadership style is seen among inexperienced nurse leaders, like they lack managing I mean so ability and all. Okay, so that is I mean laissez-faire in the sense they are, it's just like hands off, their hands are off from that particular thing. Okay, or whatever the team has to do, they don't involve, they don't guide, or they don't direct. Okay, so this kind of leadership is seen in this one inexperienced leaders. Okay, and they are good at they can be well suited in palliative sections and all. Okay, so I mean, so they give everything, they give responsibility to nurses, and these leaders will be taking hands off from that approach. Okay, and whereas I mean, so they, when certain issues arise, you know, this leader will not be capable to solve the issues. Okay, so that is the drawback of being, or being a laissez-faire leader. Understood? Okay, so these are the different kinds of leadership skills that you need to know. Fine. Okay, fine. So that was all about the leadership styles and all, and the discussion topics are I would like to wind up the discussion topics for now. Okay, so now the next session is for doing only the questions based on whatever you have discussed in the past class, and also based on the today's session. So I can, before we move into the questions, I can give you 10 minutes break. Okay, and after that we will be doing the questions. The questions are very important, the ethics questions, lots of questions are there. I want all of you to participate actively in answering the questions, because this ethics, leadership, management come under safe and effective care environment, client need, management of care, client need. Okay, so wherein you get 21% in the sense out of the whole, like maximum questions are from this basic, the safe and effective care environment. Okay, so now therefore it's very important to have a very good understanding about all the ethics related aspects, ethics, advocacy, ethical dilemma. These questions are constantly put in, and also prioritization questions. Okay, so like there are numerous clients, 4 or 5 clients, which client you will be selecting first? These kind of questions come under the safe and effective care. So therefore, you should have a very good understanding about these topics as well, which come under the management of care. Okay, yeah. So we'll do the questions after a short break. See you after 10 minutes. Okay. Okay, guys, welcome back. So let me open a few questions based on the leadership and management. Okay, so based on, let us look at how some questions you get based on management aspects. Okay, the first question is on delegation. Hope you are aware about the aspects under the delegation. Okay, so now these are the 5 main, so the areas when a nurse delegates should be aware about, isn't it? So 5 rights of delegation, you know that. Right task, right circumstance, right person, right direction and communication, and right supervision and evaluation. Okay, so you have already learned about that. So now I would like to so in this question, what does this question focus? The nurse asks a nursing assistant personnel to help the patient in room 418 walk to the bathroom right now. The nurse tells the nurse assistant personnel that the patient needs the assistance of one person and the use of a walker. The nurse also tells the assistant personnel that the patient's oxygen can be removed while he goes to the bathroom, but to make sure that it is put back on at 2 liters. The nurse also instructs the nurse assistant personnel to make sure the side rails are up and the bed alarm is reset after the patient gets back in bed. Which of the following components of the 5 rights of delegation were used by the nurse? Were all used? Or was anything left out? Right task means what? What is the so whomever you are delegating, you know, so what that delegate is going to do, the job. Okay, so that is the task. Whether it is whatever the task that has been allotted, is it appropriate for that delegating? Circumstance means what? The condition of the client. Okay, so when you delegate, remember, when a registered nurse delegates, the client's condition should be stable. Okay, that's very important when delegation is done. Unstable clients and all, you usually don't delegate. Okay, so and it should be the right person. And so you know the responsibilities of an LPN, UAP and all, isn't it? So that particular person should be involved in doing this task. Right direction and communication in the sense, now you should be specific in directing the client what should be done, how it should be done, and after that what should be done. Everything should be explained. Okay, and after everything is done, you should check whether the delegated responsibility was completed or not. Okay, that comes under supervision and evaluation. Okay, so now this is a SATA question. SATA question, so you need to know, like, based on the 5 rights of delegation, which all were used by the nurse. Was it the right task? Yes?
I think no.
It was not a right task?
Because oxygen.
So let us get back. Yeah. Task. What was the task? Assistance in using warm. Yeah,
assistant mobilization.
Assisting. Okay, so assisting to the bathroom. Okay, and to make sure that it is put back on 2 liters. The nurse also instructs the NAP to make sure the side rails are up and the bed alarm is reset after the patient gets back in bed. So these are definitely the tasks that can be done by a nurse assisting personnel. And of course, right task is correct. Was the circumstance right? Circumstance is right. Okay, so because the client, okay, so the client was able to move or ambulate, isn't it? And that is why the task was specifically allotted. Circumstance means what? The health condition of the client. He should be stable. Okay, so even though he needs oxygen, he is stable there. Fine. So they haven't given any indications that the client is unstable. Fine. So circumstance is right. And these things are done by an assistive personnel, and therefore the person is also right. And the nurse has communicated everything. So except supervision and evaluation, whereas the nurse has not supervised nor evaluated. So all the aspects are right. Okay, all the aspects are right except right supervision and evaluation. Is that clear? Okay, so I think you are a bit confused. Let me get back to the roles of UAP. UAP in the sense nursing assistant. Okay. And LPN can be enrolled nurses. Okay, enrolled nurses in Australia, enrolled nurses with medications certification is different, whereas we can still consider them as enrolled nurses. Okay, LPN. So let me just focus on the slides that will help you to get review the aspects in regard to the different areas, the rights and all. Yeah. So these are the specific rights. So the duties. RN is only involved in assessment. Remember always TAPE. Teaching, assessment, planning, evaluation, TAPE can only be done by a registered nurse. The clinical assessment, initial client teaching, discharge education, clinical judgment, blood transfusion, IV line, again, even though the phlebotomist can do that, so still initiating blood transfusion and all only by a registered nurse. Okay, so these aspects should not be delegated to anyone. Initial teaching should only be done by a nurse, whereas the LPN can reinforce the teaching. Okay, so reinforcing can be done. Now, what are the duties of a licensed practical nurses? Monitoring the findings of an RN. Okay, so RN has identified certain abnormalities in the client and monitoring the same. Identification should only be done by an RN, whereas monitoring can be done by an LPN. Reinforcing education, routine procedures can be done like catheterization, most medication administration except IV lines. Okay, so IV administration, some states in the US and all is still allowing for an licensed practical nurses, but it again depends on the state protocol. In general, licensed practical nurses are not supposed to carry out IV push and all. They are prohibited from IV push. Okay, other routes of medications are generally allowed. Okay, for an LPN. Ostomy care, tube patency and enteral feeding. Specific assessment can be done like lung sounds, bowel sounds, neurovascular checks. So these can be done by a licensed practical nurse. Okay, what does nurse assistant does? Activities of daily living, assistance in activities of daily living, linen change, hygiene needs, attending oral hygiene and all those hygiene needs. So routine stable vital signs can be checked, documenting, positioning, finger stick glucose checking, weight checking. Okay, and if any visible abnormalities are seen, so that can be reported. Okay, like for example, something is oozing or there is a bleeding and also that is actually visible, isn't it? So that can be reported to the RN. But at that time, the UAP should not do anything if abnormalities are identified or the client is having lots of pus or any allergic reactions are noted in the client. That should be immediately reported to the registered nurse by an UAP. Okay, so this delegation is very important. RN should delegate these tasks to these people only. Okay, so that's very important. So hope you have understood. Okay, so that is just I wanted to review what are the learned aspects itself. So what are you not supposed to delegate? So don't delegate total control, discipline issues, confidential tasks, technical tasks, and controversial tasks. These things you are not supposed to delegate. Okay, so even though you delegate, you are the one who retain the accountability. So the total control of the particular scenario is within you. Okay, discipline issues like any violent client and all those issues should be tackled only by you. Confidential tasks, technical tasks related to the functioning of the machines and all. So that should be tackled by you. Controversial tasks. Okay, so all this, any advocacy related issues and all should be actually dealt only by you. Don't delegate these tasks. Okay, so now let us get back to the next question. Okay, the next question is not on delegation, but on generally on management. Let us see what the question is. We will do the delegation questions too. Which example demonstrates a nurse performing the skill of evaluation? The nurse explains the side effects of the new blood pressure medication ordered for the client. The nurse asks a patient to rate pain on a scale of 0 to 10 before administering the pain medication. After completing the teaching, the nurse observes a patient draw up and administer an insulin injection. The nurse changes a patient's leg ulcer dressing using aseptic technique. Now, which is the skill under evaluation? I mean, which example demonstrates a nurse performing the skill of evaluation? Yes, that was very easy, isn't it? Third one is the right answer. None of the others come under evaluation. It goes for implementation, assessment and all. So only third option comes under evaluation. After teaching, you are checking whether the client is following the same aspect through which you are evaluating his how much he has learned, and therefore option 3 is the right answer. Very good. Okay. Now, so prioritization based questions, assignment based question is here. The oncology nurse receives a reassignment to the medical surgical unit. The charge nurse for the medical surgical unit assigns which clients to the oncology nurse. You should understand when delegation is done or when client assignment is made. What should be there in your mind when client assignment is made? Yes? When client assignment is made, you should make sure that
the nurse, make sure that the nurse who you are assigning is competent of caring the specific client.
Exactly. Okay. Yeah. So now you should note that while assigning, you should also note that there is no deteriorating client's condition too. Okay, so while delegating to some which we call as the nurses can float from one unit to the other, isn't it? So when some need arises or when there is staff shortage and all, at that time when the nurse in charge delegates, she should be delegating tasks which a nurse can do by just from her fundamental nursing skill, wherein she will have to apply only her fundamental knowledge and skills. Now you need to think which are all the scenarios or the situation where only fundamental knowledge and skills can be applied. So you need to think in that way. Okay, in which situations? So what about option 1? Client who is receiving total parenteral nutrition after gastrectomy 48 hours ago. Client who will be discharged to home today after total hip replacement 72 hours ago. Client who requires administration of pain medication after undergoing bariatric surgery 6 hours ago. Client admitted yesterday and newly diagnosed with atrial fibrillation. Client who requires QID dressing changes for treatment of an MRSA positive stage 4 pressure injury. A client admitted 3 days ago and prescribed IV antibiotics for treatment of pneumonia.
Ma'am, 1, 3, and 6.
1,
3, and 6.
You say 1, 3, and 6.
1, 3, 5, and 6.
Okay, 1 is right. Yes, very good. Because there is nothing like the client is on TPN, isn't it? So when a client is on TPN, you should be applying only the basic fundamental knowledge. So nothing worse is going to, I mean, so you cannot see when you select SATA questions, you need to think it as true or false, whether I can apply to a medical, to an oncology nurse or not. Yes or no, you need to think in that way. You should not think whether the client will have some complication, etc., etc. If you think in that way, you end up in too much of analysis, will end up in wrong answers. Okay, just take the situation as it is and think like whether the fundamental knowledge of a nurse can be applied in dealing this situation or not. You need to think in that way. Client who is receiving TPN after gastrectomy 48 hours ago. What's wrong in allotting to an oncology nurse? Yes. Okay, definitely this can be allotted to an oncology nurse. Client who will be discharged to home today after total hip replacement 72 hours ago. Can client 2 be allotted?
No.
No,
No.
ma'am.
Why?
No, ma'am.
Why?
Discharge
Discharge
teaching
teaching.
needs to be
Discharge teaching is
Teaching.
required, isn't it? Okay, so discharge teaching is required. So therefore you cannot delegate. Allot. Client who requires administration of pain medication after undergoing bariatric surgery 6 hours. Look at the variable here. 6 hours ago. Can you allot?
No.
No,
More than
you
12
can.
hours.
Yes, exactly. Okay. So not 12 hours, 24 hours. It should be at
Sorry,
least
yes.
24 hours past before allotting. Okay. The client is within 24 hours and therefore he is at high risk of complication. So you cannot allot it to a nurse who is specialized in oncology session. Okay. So therefore this cannot be assigned. Client admitted yesterday and newly diagnosed with atrial fibrillation.
No, ma'am.
No.
Atrial
No.
fibrillation, newly
No.
diagnosed cardiac abnormality cannot be assigned. Okay, so that should be assigned only to a special nurse who knows the care of all the cardiac events or all the cardiac situations. Okay, so this also cannot be assigned. Client who requires 4-time dressing changes for treatment of MRSA positive stage 4 pressure injury. Yes or no?
Yes.
Yes.
Yes. Okay. Dressing changes can be done based on the nurse's fundamental knowledge and skills, isn't it? Yes. So therefore, so this is yes. What about client admitted 3 days ago and prescribed IV antibiotics for treatment of pneumonia?
Yes,
Yes.
ma'am.
Yes.
Yes. Okay.
Yes.
So very good. So whenever you get these kind of questions, please understand that when another unit nurse is working in your unit and the nurse has to delegate or assign certain responsibilities, or the clients, when the nurse has to assign clients, okay, you need to make sure that whether that nurse has got the sufficient skill to take up that action. She should be either having experience in working in that unit, or else she should be at least having the so being a nurse, she will have the fundamental knowledge. So you need to select the clients who requires only the fundamental nursing skills to be applied. So those client only you will have to assign. Okay, so when floating is happening, fine. So therefore, so 1, 5, and 6 are the right answers. Yes, we'll move to the next one. The nurse manager overhears a staff nurse working with the student nurse. Which statement, if made by the staff nurse, indicates that the staff nurse is unfamiliar with the role of a student nurse? I mean, among these things, which thing, if done by a student nurse or told by a staff nurse to the student nurse, is actually wrong? After you complete a full assessment on your client, the staff is telling to the student nurse and the nurse manager is overhearing that. There is one thing which she said that is wrong, okay, which a student nurse should not do. Which is that? After you complete a full assessment on your client, I will double check it before you document. Is it right? Can this
No.
be? Why?
Yes.
Yes.
The patient yes.
Yes,
Yes.
okay. Yeah, the nurse is actually double checking it before documenting, isn't it? So therefore, so this can be right. Okay, so please don't get confused. I'm not talking anything about the delegation here. The question is not assessing on delegation. Okay, the question is assessing whether the things what a student nurse can do, yes or no. Definitely she can assess the client, but before she cannot document it. Before documenting, so the nurse, the registered nurse has to check it, double check it, and then only document. Oh, of course, this is right. Okay, before we go into the client's room, review with me how you will insert this indwelling urinary catheter. Yes or no?
Yes.
Yes,
Yes.
of course.
Yes.
Okay, yeah. Before we go into the client's room, do you have any questions about how we are going to transfer this client from bed to chair?
Yeah. Yes.
Yes, exactly. Okay, so I mean that should be the nurse has to collect information from the student. Okay, so whether she has got the sufficient knowledge on transferring the client or not. Okay, so therefore, so this is also right. Fine, so that is appropriate actually, because here the nurse is providing an opportunity for the student to describe about the transfer and to ask questions, so that the client will receive a safe care. Okay, so in order to ensure safety of the client, so making the nurse, student nurse, to ask the questions for any doubt before transferring the client is very important. And of course, third one is right. Okay, what about then? Of course, the answer is the fourth one. But why fourth one is the answer? Why this is not right? Why? Because see here, it is
The
given when you
student doesn't call healthcare
You cannot call
provider.
the physician.
no, student can call healthcare provider. Usually healthcare provider before health, even though the healthcare provider can be called, the student nurse is not licensed to take prescriptions from the healthcare provider. Okay, so here what they have given, write down any prescriptions you receive. Make sure you write down any prescriptions you receive. That is told by the staff nurse. Now, student nurse is not supposed to write down any prescription. Okay, and therefore the fourth answer, the fourth question is considered as wrong. Okay, and that's why this is the right answer to this particular question. Fine. Okay, so we'll move to the next one. The nurse transports a client by stretcher for a stat CT scan. The client is being continuously monitored with the transportable cardiac monitor. En route, the monitor loses battery life and turns off. Which action does the nurse take? Turn stretcher around and return to the medical unit. Phone the HCP and request the client be downgraded to a non-telemetry unit. Notify the charge nurse to bring another transportable cardiac monitor to the radiology department. Proceed with the diagnostic test with the monitor off. Place a portable SpO2 sensor on the client's finger to monitor the heart rate. What are correct? Can she turn the stretcher around and return to the medical unit?
No, ma'am.
No, that will take, it is like, I mean, so the here, the order is stat, isn't it? Stat CT scan. And the client is continuously monitored with the trans. So when immediate CT scan has to be carried out, she cannot turn the stretcher around and return to the medical unit. So this is wrong. Okay. Phone the HCP and request the client be downgraded to the telemetry unit. Is it right?
No.
No. Okay, non-telemetry unit. Downgrading is not the solution. Okay, so downgrading is not the solution here. I mean, so stat, this has to be done. So then what could be the right answer? Third one?
Third and
Yes,
fifth.
yes. Okay, so this indicates that the nurse is resourceful. Okay, so she can notify the charge nurse to bring another transportable cardiac monitor to the radiology department. So that's very important. So she is resourceful. She's having the adequate knowledge on what to do. Okay, so can she proceed with the diagnostic test with the monitor off?
No.
No, even that cannot be done. Place a portable SpO2 sensor on the client's finger to monitor the heart rate.
Yes.
Yes. Okay, so to this also can be, while waiting for the cardiac monitor, the nurse can do that. Okay, the question is en route. So during the thing, so en route, the monitor loses its battery life, and at this situation, what all things she can do? Okay, because there is a prescription that so there is an order for stat CT scan. Okay, so she can't take the client back to the unit. What else, what better options can be selected here? Okay, so therefore, so 3 and 5 are the only right answers. Okay, these are all management based questions, the similar kind of questions you can expect in the exam, very important questions. Okay, yeah, moving to the next one. The charge nurse in the emergency department assigns a client to a new nurse who has been off orientation for a week. New nurse is off, she was not there for orientation. Which client assignment is most appropriate? Now you give me the answer. Read, understand, and give me the answer. See, you need to consider each situation closely. Okay, so the nurse was off orientation, that too in the emergency department. Okay, and which assignment is appropriate? 3-year-old with a temperature 102 who had a seizure at home 30 minutes ago and is very irritable. 8-year, this client is unstable, so you cannot, isn't it? So this client is unstable, so you are not supposed to assign the client, because so seizure, the client is irritable here. So so if you assign, the new nurse may not be able to take care of the client, because she may not know what to be done, because this client might require immediate diagnostic testing such as blood culture, lumbar puncture, and so on. Okay, so therefore, so this is not the right answer. So the option 1, this client cannot be delegated. 80-year-old with a closed fracture of the clavicle following a fall, who is talkative, and he rates pain as 2 on the 0 to 10 faces pain scale. Okay, you know that the faces pain scale, all the smileys, the emotions are there. Okay, so and in that, so he's rating it as 2, which means that so this client has a closed fracture. Okay, and it is usually very common in children, that to below 10 years of age, and usually it can be treated conservatively, isn't it? Nothing else is done, and also the client has minimum pain, and this can be assigned. But let us look at other cases too. So so the next one is 32-year-old with asthma who has an upper respiratory tract infection and peak expiratory flow that is 45% of personal best. See, under peak flow meter, so which is considered as worst? Tell me. It's given here as 45%. Is it okay, or is it waste? Or is it worst? Yes, 45% in the sense?
Oh.
Yes,
It's not okay.
it is not okay. It should be greater than 50%. Okay, it is less than 50%. So therefore, it is not okay, and you cannot, this is not an appropriate assignment. Okay, it is not an appropriate assignment. And what about the last one? 72-year-old prescribed antibiotics 3 days ago to treat acute sinusitis who report shortness of breath and has a rash. So this also requires immediate intervention. Okay, so therefore the safest assignment for a new nurse will be option 2. Right? Yeah, so that was a very good answer. Yeah, we'll move to the next one. Which client is most appropriate for the 7 to 7 p.m. charge nurse on a cardiac step-down unit to assign to a float registered nurse from a medical surgical unit? Whether for a medical surgical unit, so this nurse is in the cardiac unit, and which client you will be giving to a float nurse from the medical surgical unit. Client who just returned to the unit after coronary angioplasty and placement of a stent. Client with atrial fibrillation scheduled for electrical. See, the first one you think, who just returned they have given. Okay,
No.
so just return client, no, you cannot, isn't it? So you cannot assign to an inexperienced client who is not working in the unit. It should be handled by an experienced client itself, who is familiar with the stunt post-procedure interventions like monitoring for bleeding and post-procedure complications, checking for neurovascular compromise. Okay, all these aspects, the one who is very familiar should only be allotted. Okay, so therefore, so option 1 is not the right answer. Okay, what about the option 2? Client with atrial fibrillation scheduled for electrical cardioversion this afternoon.
No, ma'am.
This afternoon it is, isn't it? But still, why you are not giving?
Because client with AF.
Yes, no, client with AF and after
Schedule.
cardioversion, yeah, after cardioversion complications can arise. Okay, so that should be monitored, and the new nurse may not be having the sufficient knowledge of that. Okay, so to monitor for the post cardioversion complications. So therefore, so this also cannot be selected. Okay, client with heart block scheduled for pacemaker placement this afternoon. Can you give? No.
No.
Why?
No,
Why?
ma'am.
Post-op complications.
Yes. Okay. So again, like post-op complications can happen here. So therefore, so not third one. So whereas fourth one is the right answer here, client with heart failure and DVT receiving an IV infusion of heparin. Why can you consider this as a safe procedure? Because these all are the monitoring that can be done in the medical surgical units also. Okay, a medical surgical unit nurse should be familiar with the assessment, nursing care, medications and all that are given for a heart failure client and all. Okay, so therefore, so this can be option 4 can be considered as the safest assignment. Okay, yeah, that's why 4th is considered as the right answer. Yeah. We'll move to the next one. Okay, now there is a question on delegation. Okay, so you can read the question. So delegation. The registered nurse on a medical surgical unit is working with LPN and UAP. Both are there. Okay, LPN is also there, UAP is also there. So which tasks are most appropriate to assign to the LPN? Administering a scheduled analgesic to a client with chronic back pain, so whose pain is 8/10. Can this be done by an LPN? Medication?
No.
No? What's
Yes.
wrong? Yes,
Ma'am,
medications can
first
be.
one is right.
First one is right, exactly. Okay, so oral analgesics definitely can be given by an LPN. So why didn't you select that? Yes, this is right. Assessment of assessing
ma'am.
fluid? No, when you read assessment only, you should say no. Very good. Okay, so assessment, assessing a client whose fluid volume status, so you need to assess for the fluid volume status of a client with heart failure who is scheduled for discharge. No, that should be done only by, an RN. Okay, so see, LPN can check, do the specific assessments like lung sounds and all. So whereas fluid volume as status of a heart failure client and all requires a complete assessment. Okay, the nurse will have to have a good knowledge about the fluid volume, signs and symptoms associated with the fluid volume overload, deficit, how the urine output is, and also this client is for discharge and he will require discharge education also. So which is the sole responsibility of a registered nurse. Okay, so therefore option 2 cannot be selected as an right answer. What about option 3? Who can do this? Bathing, feeding,
LPN.
dressing, UAP.
LPN.
UAP.
Sorry.
Okay, so this goes for a UAP's job. Performing wound care with sterile dressing change for a client with stasis also.
LPN.
LPN,
Yes.
LPN, yes, good. Providing incontinence care and linen change for a client with diarrhea.
UAP.
UAP, very good. Okay, so 1 and 4 are the,
Ma'am, I have a question.
yeah.
Instead of, because the pain is 8/10 or 9/10, if the question was like administering a PRN analgesic to a client with a chronic pain currently rated at 9 out of 10, so would that be under LPN scope, like working scope, or not PRN?
See, it comes under the LPN itself, as far as they have mentioned IV. Okay, IV, PB and all. So then the LPN is not supposed to give.
Even the
Okay.
PRN can be given by LPN?
Yes. LPN can be given. Yeah?
Yeah.
Okay.
Yes. Thank you.
Yeah, fine. So we'll move to the next one. Okay. All nursing staff on the medical unit are responsible for implementing a new interdisciplinary fall prevention protocol. Which tasks are appropriate for the RN to delegate to the UAP to promote client safety? So UAP, what are the responsibilities here? So which a UAP can do? So this is also a SATA question. Okay. So can the first one be done orienting the client to the bedside unit and explaining the call bell system and all? So who has to do this? Who has to do this?
RN.
RN, yes, exactly. Okay, so the initial, the client orientation, teaching and all, who has to do? Only an RN can do that. Yes, okay, so therefore this is not the answer, because this RN has to do. Place the bedside commode as close to the bed as possible.
Yes.
UAP
Yes,
can
UAP
do.
can do.
Yeah. So remind the client to change the position slowly.
Yes.
Yes. Definitely UAP can do that. Report observations of changes in client's condition immediately.
UAP.
Yes, exactly. Okay, reporting. They have given us reporting. So definitely UAP can do. Report whether client is using correct gait and balance while ambulating with a walker.
RN.
Alteration in gait, balance and all can be assessed by who? By RN. Yes, RN mainly. Okay, so therefore, so this is not the right task. So only 2, 3 and 4 are the right answers that can be done by a UAP. So please keep reviewing these, okay, the duties of an RN, LPN, UAP, because at the end you will forget before exam. So therefore, and definitely you will get questions on this. Yeah. So the next one. Which task can the registered nurse safely delegate to the UAP? SATA. Ambulate an oxygen-dependent client to the bathroom.
Yes.
Yes.
Yes?
No.
Yes.
Yes.
Yes or no?
Yes,
No.
ma'am.
Yes.
Yes,
Yes?
ma'am.
Yes. Okay.
Yes,
Yes.
if the
Amber.
client is stable with the
Yes.
Yes.
oxygen.
Yes.
Exactly. Okay. Assist the client with dentures to perform oral suctioning after the client's meal.
No.
No.
Oral suctioning.
Yes.
Yes, that's not wrong. That's a non-sterile way, right? It's only an oral
Yes.
care. Definitely a UAP can do that. Okay. So it doesn't require, it is not a sterile procedure as such. Okay. Yeah. So even the second one can be delegated. Document pulse oximetry of a client with COPD.
No.
No?
Yes.
Yes, ma'am.
Yes, okay.
Right.
Documenting. Do you remember I had told documenting vital signs? I had shown in the list.
Yes, ma'am.
Yes,
Yeah.
okay. Collecting and documenting vital signs can be done by an UAP, okay? But remember, for stable clients. Yes. So, and instruct a client with pneumonia on use of the incentive spirometer.
No. No.
Okay, this she cannot do. Turn and reposition a client with pneumonia.
Yes.
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 Yes. Okay. So again, she can do that. So therefore, so these are the, yeah, this is also the right answer. Okay. Yeah. Very good.
So, ma'am, sorry, the oral suctioning,
Yeah.
UAP can do oral suctioning,
Yes.
right?
Yes. Yes. Last option UAP can do. Okay. Yeah.
Okay.
Fine. We'll move to the next one. The registered nurse is discussing care of shared clients with the LPN. Which of the following clients require intervention by the RN? Okay, focus the question. Which clients require intervention by the RN? Even the LPN is monitoring here, whereas specific interventions are required by the RN. So which are those clients? A client receiving a blood transfusion who reports severe anxiety and has a blood pressure 90/60 and pulse 110.
Yes.
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 Yes, very good. Okay, so why RN's intervention is required here?
Severe
There's a sudden
anxiety
change in the
and
condition.
Reaction.
bloody
Yes,
bleeding.
exactly. I mean, the client is having some hemolytic reactions, isn't it? Transfusion reactions. So therefore, so option 1 is one of the right answer. Okay, so move to the next one. A client receiving oral metoprolol whose heart rate has decreased to 60 after administration. Is intervention required or not?
No.
No.
No, because it is 60 and that is what you expect here. Okay.
Is expected.
Yeah, it is expected. So therefore, don't. So while doing SATA, always check, are there any interventions which are expected to the scenario or to the STEM that they have asked? Okay, it could be in diseased conditions and all sometimes. Okay, so a client with the psoriasis admitted, etc., what is needed? So they might give that complaining of severe itching. So you need to think this is an expected thing. So no need to intervene there, okay? Because itching will be there in psoriasis. You need to think in that way while doing SATA especially, okay? That will also help you to select the right answers. Expected aspects can be eliminated depending upon the scenario, okay? A client whose blood pressure decreased from 130/80 to 110/70 following administration of 1 mg hydromorphone IV. Hydromorphone is an opioid, isn't it? So opioids, what generally they do? Opioids,
they relax the
yeah,
like
they
the press.
relax. Very good. They relax. They lead to vasodilation, and therefore, so this is an expected aspect. Okay, so this is expected because opioids lead to vasodilation. There can be a little decrease in the blood pressure due to vasodilation, and this is expected. No need to intervene. A client whose blood pressure was 90/65 before prescribed oral nifedipine was administered.
You need to intervene
Need
because
interventions.
What in?
the you
Yeah.
shouldn't
Because
give when
patient
it's
having
low.
hypotension.
Yes, okay. So nifedipine is usually used to treat hypertension, isn't it? So now here the client is hypo and you cannot give that. So therefore prompt assessment is very much required. So therefore option 4 is an intervention by the nurse. Okay, yeah. So a client whose pulse increased from 70 to 100 after albuterol administration. Albuterol come no intervention, because in respiratory you would have studied, isn't it? So albuterol,
Yeah.
yeah, they cause what? Tremors, tachycardia, isn't it? So that's the expected one. Expected one. Yeah. Therefore, say 1 and 4 are the right. So this is what I say, like everything, whatever you study, you know, in some or the other way, when you do the questions, so that will be useful. Okay, so therefore every aspect you need to mainly note down the points, make your own notes. So in respiratory, when I was discussing, I had told about the bronchodilators, the side effects, TT, remember TT, tachycardia, tremors. Okay, so now if you would have written that, if you would have remembered, so you will be able to answer this one. Okay, and then you will be able to get the right answers. Okay, so therefore knowing all these aspects are very important. 1 and 4 are the right answers for these questions. Moving to the next one. The registered nurse is working with a licensed practical nurse and an unlicensed assistive personnel. A client has just returned to the cardiac unit after percutaneous coronary intervention. Which actions are most appropriate for the registered nurse to assign to the LPN? So you need to select the options that can be given to an LPN. Yes, option 1.
Yes.
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 Yes, option 1 can be given. Yeah. Assess the client with the use of a urinal post procedure. UAP has to do that. Okay. Yeah. So not this one. Monitor for bleeding at the catheter insertion site every 15 minutes.
LPN.
LPN. See, RN has already identified there would be bleeding. Okay. So now monitoring RN's findings is the duty of LPN. So this third one is the right answer. Perform the initial post-procedure vital sign measurements. Who has to do that?
RN has
RN has to do. Okay. Review the ECG monitor for dysrhythmias. RN has to do. Okay. Yeah. Yes. Very good. So 1 and 3 are the right answers. Fine. Okay. The next one. The registered nurse and the LPN are caring for a client with an established colostomy. Which nursing in actions may the RN delegate to the LPN? Which nursing actions may the RN delegate to the LPN? SATA. Assess perfusion of the stoma tissue.
No.
Yes.
No. Stomach care. Yeah, stomach care can be done by an LPN. Okay. So whereas assessment. Okay. So yes, assessment. See, RN can delegate specific assessment to the LPN. Whereas, for example, whatever the so the quality and all those things can be done. Okay. So whereas, but here the assessing the perfusion. So which nursing actions may the RN delegate to the LPN? So that is the question given here. So assessing the initial assessment and all can be only be performed by a registered nurse. Okay, so that's very important. Ostomy care or checking the providing ostomy care and observing for skin breakdown and all can be done by a LPN. Okay, yeah. So assess the client in changing the ostomy pouch.
Yes, ma'am.
Yes, she can do that. Auscultate the client's bowel sounds.
Yes.
Yes. Yes. Develop a plan of care to prevent the skin breakdown.
Aaron has to do.
No.
RN
No.
has
No.
to do.
No,
Yeah.
Aaron.
Okay. RN has to do. Yeah. Fine. So then monitor the color of
Yes,
ostomy
ma'am.
drainage.
Yes.
Yes. So this she can do. So 2, 3, and 5 are the right answers. Okay. Fine. So which are appropriate examples of cost-effective care? You should give the appropriate examples of a cost-effective care. Which are those? Cost-effective care. You can read and try to get the points. Considering the inside of the sterile glove wrapper as a small sterile field.
Yes.
No.
Yeah.
Yes?
Yes, it's
Yes,
sterile.
it
Yeah.
is sterile, isn't it? So therefore it can be considered as a cost-effective care. Donning clean rather than sterile gloves to remove a client's dressing.
Yes.
Yes.
Cost-effective care?
Yes. Yes.
Yes, ma'am.
Yes? Yes. Okay.
Yes.
Fine. So returning opened unused supplies from a client's room to the CS central supply room.
No.
No, to the supply room you cannot.
No.
Okay.
No.
Yeah. Reusing a tourniquet for multiple clients unless it is visibly soiled.
No.
Yes.
No.
Reusing, no. Okay. So
No.
multiple
No.
clients you cannot do that. Using remaining sterile saline in a bottle open 48 hours ago before discarding.
No.
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 No. Okay. So that is also wrong. Fine. So therefore, so 1 and 2 are the right answers here. Okay. Yeah. So I think these were some questions that is me, like I mean, I'm checking if there are any other questions. Just a second. In this delegation. Okay, so we'll do the next set of questions are under ethics. So ethics-based questions I'd like to focus here. Just give me a moment. Let me just open that. Hope you are thorough in knowing the delegation aspects. So please review that again and again. It's very important. Okay, I'll just try to share my screen. Hope you can read. Yeah. So the first question, which statements related to the ethical nursing practices are correct? SATA. Accountability is documenting that the nurse administered wrong medication. Autonomy is, give me the answer for the first one.
Yes.
Accountability means? Accountability means? Right or wrong?
No.
Wrong.
Wrong.
Account,
Yes,
yes, you are accountable for your action, isn't it? So it is actually accepting your own action and admitting it. So definitely option 1 is right. Okay. Yeah, option 1 is right. Autonomy is informing the client of the decision the family made for the client.
No.
No.
No, ma'am.
No.
Confidentiality is respecting a client's request to keep suicidal ideation a secret.
No.
No.
No. Why it is no?
No.
Why it is no?
Because
Safety measures need to be taken at
Yes,
all times.
exactly. Okay. So confidentiality means, yes, like, I mean, whatever the information is shared should be kept in confidence until the permission is given to share. Okay. Or sometimes the law will ask to share. So then only you can share. Fine. Whereas if suicidal ideation and all is discussed, so that should not be kept confidential, because so that affects a client's what we can say, that is something that affects the life of the client. Okay, so self-harm should be reported. If the client has an intention to self-harm, so that should be reported, and therefore so this is not right. Justice is providing the same cardiac care to a homeless person as a business person.
Yes.
Yes.
Yes. Non-maleficence is reporting abuse for a client with Alzheimer's disease.
Yes.
Yes.
Yes, yes. Okay, so non-maleficence means what? No harm.
No harm.
No harm. Okay, so protecting the individual from physical or physical harm or mental, so emotional trauma and all, protecting them, or that is no harm. Okay, so non-maleficence. So therefore,
But we do like reporting abuse for any client, or is just the client with some specific conditions like
any
Alzheimer's,
client, if abuse is happening, it's your right to report immediately to your line manager. Any
Okay.
client. Okay, so that's
All right.
very important. And also, if you come across there could be certain situations while caring for the clients, you may observe numerous bruises on his body that has got old and new healing indications. Okay, so if you are identifying new and old bruises on the body, what does that indicate? That also indicates abuse, okay, or violence against, harm against the client. Even that has to be reported. Okay, or any cigarette burnt lit marks, burnt marks in the gloved region or in the socks region and all, so even that has to be reported. Okay, so that's very important. Yeah. But there could be sometimes two things that might confuse you. If you are in the midst of a situation where the abuse is happening, you are actually seeing the abuse being your client is being abused, so then your initial responsibility will be rescuing from that situation. Okay, and after rescuing only you can inform. So bringing a client to safer situation, assessing the client is very important, and after that only you can inform. Okay.
Yes, but what if the client doesn't want to report or anything for domestic violence? Because yes, I read somewhere that we have to talk to client in, like, we have to take them to a safe place, or either we can ask them to go to the, like, let's go to the toilet, and then we can communicate if they have been they have been suffering from abuse. But what if the client doesn't want to share
No,
with us?
still it is your duty to report. Okay, because he
Okay.
is under
Yeah.
harm, so therefore it's your duty to report.
Okay.
Yeah. Okay, fine. So the acute care clinic nurse administers a prescribed narcotic for a client with renal colic and then discharges the client without ensuring that the client has a designated driver. The client is subsequently involved in a motor vehicle accident causing injury to self and others. Which ethical principle did the nurse violate?
Two.
Two? Non-maleficence. Yes, exactly. Non-maleficence, isn't it? So now here the nurse, that was actually sometimes what happens is non-maleficence in the sense doing no harm. Okay, you need to make sure that it should not be unintentional. Also, tort, you would have learned about the tort, intentional tort and unintentional tort. So non-maleficence, doing harm to the client, if you violated the principle of non-maleficence in the sense, that can come many times under unintentional tort. Okay, so therefore here, so option 2 is the right answer. Autonomy means what? Autonomy in the sense allowing the client to decide for themselves. Okay, their choices and all are actually taken into consideration. So that is autonomy. Paternalism acts in situations mainly for mentally incompetent clients and all, where the nurse will know what has to be done for this client, what is best for the clients, and based on that the nurse will actually decide for the client. So that is paternalism. And veracity means what? Being
The truth.
truthful. Yeah, being truthful to your client. Okay, yeah. The next one, during shift change, the night nurse notices that the graduate nurse administered IV dopamine instead of norepinephrine for a client with sepsis. What should the night nurse do first? Administer the correct medication and obtain current vital signs, alert the graduate nurse and complete an incident report, assess the client and notify the HCP, discontinue the dopamine and inform the nursing supervisor. What are you supposed to do first? Medication.
Discontinue first.
Medication error has occurred, isn't it? So whenever the medication, what you will be considering as the first priority?
Assess the client and notify the healthcare provider.
Assessing the client.
Okay,
Yes.
3.
Yes, 3 is the right answer. Okay, you should assess the client immediately for any adverse effects before any further actions are taken. Okay, so I mean, yeah, so there is some disturbance. Before any further action is taken, assessment is the top priority. Always assess your client first. Okay, dopamine can be discontinued, but there should be some other medication also to stabilize. Okay, so and that you don't know, so for that informing, so therefore before discontinuing and all, it's very important to notify, assess your client and notify immediately, and that goes as the best answer here. Okay, yeah. Moving to the next one, the nurse is caring for a terminal ill client, asks if the client has an advance directive. The client says, I already have a power of attorney. What is the best response by the client? A power of attorney is good to have in place. It sounds like you are on the right track. Great, your power of attorney can start to make decisions for you when you are no longer able to do so. Many people find a lawyer at this stage of life. A lawyer can help you get your affairs in order. There are many types of power of attorneys. Let's clarify if your power of attorney can make healthcare decisions for you.
4.
Which one?
4. There are many
4.
types of power of attorney. Let's clarify if your power of attorney can make healthcare decisions.
Yes, very good. Okay, so that is the right answer. Fine. So now here further clarification is very important. Power of attorney in the sense there is a representative to make decisions on the patient's behalf. Okay, this representative can be allotted for medical matters and also for financial aspects. Okay, usually the one who is so usually there will be two. One is medical power of attorney and the other one is mainly for the dealing with the financial aspects. Okay, so therefore what type of attorney the client is having, knowing that is very, very important here. Okay, so therefore the initial question should be the option 4. So let us know like what kind of further clarification on the type of attorney is very important. Okay, so therefore option 4 stands as the best one. Okay, so we'll move to the next one. The clinic nurse is teaching a client about the advance directive form that needs to be completed. Which statement indicates that the client understands the information? I will get this notarized as soon as I can. I will give a copy of this to my daughter who is listed as my healthcare proxy. I will put this on my refrigerator so no one will give me CPR. You and my daughter can witness this for me.
Number 2.
Number
Two.
2.
Second, ma'am.
Second, what
Yes,
did you
ma'am.
understand by this? What about the first one? Notarized? Is it required to be notarized? Advanced record?
No.
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 No. Okay, so where it can be done in the healthcare setting itself, provided there should be 2 witness. Okay, so there should be 2 witness, and both witness should be someone who outside, in the sense these witness should not be involved in the direct care of the client. Okay, and these witness should not be the one who is already taking up the I mean, so the who is already allotted by the client. So even they cannot act as a witness. They should be totally different. Okay, other people who are one who is not involved in the care, and also who doesn't come under the I mean, so the client's allotment. Okay, so those persons should be acting as a witness. Fine. So notarization is not required, so therefore this is wrong. I'll give a copy of this to my daughter, who is listed as my healthcare proxy. Yes. Okay, so the copy should be given to everyone listed as healthcare proxies. So that's why this is very important. Let us look at the third one. I'll put this on my refrigerator so no one will give me CPR. Can this be done?
No, ma'am.
Yes, no, isn't it? So it is a document that is usually kept in the hospitals and all. It's not needed to keep in the refrigerator and all. Okay, yeah. So, and therefore the third one is not the right answers. So what about the fourth one? You and my daughter can witness this for me. You and my
No.
daughter. No. Okay, yeah, the nurse cannot act as a witness there, and even the doctor.
Even the doctor.
Yeah, even the doctor also. Okay, so therefore, so option 2 is the right answer. Very good. Yeah. The medical surgical nurse cares for a group of clients. Which client situations would prompt the nurse to notify the healthcare provider during the middle of the night? Okay, so which are the situations that will, wherein you need to alert the doctor even in the middle of the night? Client develops right-sided upper and lower extremity drift.
Yes.
Yes, why?
Sign of VA.
Sign of CVA, very good. Okay, so that should be a call. I mean, the doctor should be called. Okay, so you should stroke, code blue, and all are the concerning factors where an HCP has to be called. Okay, any significant changes in vital signs, okay, or one side getting paralyzed or one side drift, any changes in the level of consciousness. So these all, I mean, so any deterioration in the client's health, or suddenly if the client dies, or the client's laboratory value is showing highly abnormal result. Okay, or even when there is a prescription which needs clarification, you are not clear about the prescription, whereas it is the time to, now it's the time to give that particular medicine to your client, and you are unclear, you should not think that it is not right to disturb the doctor. You should call the doctor. Okay, when you need clarification for a particular prescription, you should call the doctor. Okay, and even if your client runs away from that particular ward, you need to call the doctor. Okay, and if the client refuses any important treatment, okay, you should call the doctor. Okay, yeah, so emergent call is warranted mainly for fall or any unilateral drift or sudden deterioration, death, any critical laboratory results, okay, any prescription that needs clarification, or if the client is going away against the medical advice, AMA, against medical advice, or if he refuses any treatments, key treatments which has to be given during that time. Okay, the client is refusing, you should call the doctor. Okay, so these are the important situations. Now, so of course, option 1 is right. What about option 2?
Is right.
Yes,
it's
fall.
right.
He
Yes.
has a fall. That's right. Client has ordered for heparin with the surgery plan for the morning.
Yes, it's correct.
No.
Yes,
Yes.
yes,
Yes.
yes, yes. Okay, because heparin should be suspended usually before surgery, isn't it? So yes, client has serum sodium of 124.
No.
No.
Sodium is decreasing. What's the sodium
Yes.
normal level?
135 to
135.
145.
Yes, yes. Therefore, it has, because a decrease in sodium can cause seizures. Okay, many other
Yeah.
problems. So therefore, this has to be reported. Client refuses a prescribed routine pain medication.
No.
No.
No. Okay, no need to call. So 1, 2, 3, 4 are the right answers. The nurse witnessed a signed informed consent for an inguinal hernia repair surgery. During the procedure, the surgeon discovers a secondary ventral hernia that also requires repair. That was during the surgery. Okay, so which action should the nurse perform? Which action should the nurse perform? Add the secondary hernia to the consent form that the client signed before the procedure. Can you do that?
No.
No,
You can't.
you can't. Okay, yeah, you can't do that. So yeah, what about the second one?
Yes.
Yes, ma'am.
Yes.
Right.
Call the client's
Yes.
medical to provide consent for the additional procedure. Yes, that is
Yes.
right.
Yes.
One thing that you can do. Document that an additional hernia was found and that will require surgery at a later time. Why can't
No.
this be taken into consideration?
The
Because the
patient will
question
have
has
to go to
mentioned like it
surgery.
requires repair as soon as
No,
possible.
no. That is not the answer. So here, the best thing you need to focus here. First, the client's family has to be called. Okay. And even if they refuse that, even if the family member refuses, then you can go for the third one. Okay, like you can based on the best interest, see, you need to always focus on the best interest of the client, because if you don't repair it now, later it can be a financial burden also, and a further burden on the client, or a physical strain also. Both physical and financial strain also can happen, isn't it? So therefore, first the family members consent has to be taken, and if the family members do not consent it, then you can like mention that it requires a repair. Okay, so in that way you can mention. Fine. Okay, so therefore this what about the fourth one? Witness an additional consent after
No,
both. No,
No.
no. Therefore, so second one is the right answer here. Okay, yeah. Moving to the next one. Which of the following are examples of medical battery? SATA, medical battery. A child is placed in a papious restraint for suturing of a facial laceration with the parent present. What is that?
No. No.
It doesn't
No.
come on. Yeah, why?
Because restraints are not considered as battery, especially when it's for the patient's benefit.
papious in the sense like we are actually, what did you understand by papious restraint? It is for, usually it is just like a binder. Okay, it will bind the body. That is temporary actually. In order to see, child and all can move his hands and fingers and all, and during the procedure, so that can actually harm the child itself. Okay, so therefore it is therapeutic. For therapeutic purpose you are putting this, and this cannot be considered as a battery. Battery means what? Battery means what? Medical battery means
unintentional touch.
intentional harm. Okay, so touch. So that is something we can call it as battery. So option 1 cannot be considered as a battery. Applying soft wrist restraints to the arms of a confused adult client with NG tube.
No.
No, this is
No,
also,
is it right?
yeah, this is also right, isn't it? So I mean, the next one. The nurse administers 2 mg morphine PRN to a difficult, alert client, but tells the client it is saline.
Wrong.
Yes,
Yes.
yes,
Yes.
this
Yes.
is
It's a medical battery. Yes, ma'am.
yes, this comes under this the client, the nurse is not supposed to do this. Okay, so this comes under the medical battery here. So I mean, so battery is intentional touching, okay, so which is legally unacceptable, or without the person's consent if you are touching, so that is battery. Okay, so without receiving the informed consent and all, so committing battery can be legally charged. Okay, so therefore here, like I mean, without proper consent from the physician, so you cannot go in for this. So therefore, so option 3 comes under the answer. Okay, yeah. What about the option 4? The nurse inserts a needed urinary catheter even though a competent client refuses it.
Comes under
Yes.
medical battery.
Yes,
Yes.
it comes under
Battery.
medical battery. The nurse threatens to put a client in restraints if the client does not stay in bed.
Right answer.
Why?
It's come under
Does it come under
This
battery?
is assault. It's
Assault.
It come
Assault.
under
Also,
assault. Yeah,
Assault.
it comes
Yes,
under
sir.
assault. It's not
Okay.
battery. Okay, so therefore 3 and 4 are the right answers. Okay, yeah. So that was all about some questions based on the ethics and legal practices. Do you have any doubts so far based on the questions? Yes?
No, ma'am.
Yeah?
No, ma'am.
No? Okay, please review, practice the
No, ma'am.
questions once again. Okay, so fine. So then we'll wind up today's session. So see you on Friday. Okay, take care. Bye.